One day, while I was at work, I got a call from a patient who had COVID. They were having problems breathing. And so I thought that was unusual, and I asked the patient about if they had any other respiratory problems, and they explained to me they also had asthma. They had Provenal or ProAir, but they didn't have any long-term medications. I went to find out where our peak flow meters were, and I found out that our pharmacy doesn't carry peak flow meters because of the patient's pay sources.
Essentially, patients who have asthma or other respiratory conditions utilize peak flow meters as a way to kind of monitor their progress as they're progressing. And unfortunately, because of the patient base that we serve, they were unable to acquire these devices from pharmacies or other sources just because of the affordability of them.
Because there were no peak flow meters, our patients were going to the ER for care for asthma. So I then talked to my boss, Daniel, and Daniel is amazing, and he tried to find peak flow meters for me, and he couldn't find any. So I looked online. I saw the American Lung Association had a class on secondhand smoke, and I signed up for the class. I went home that night from work and signed up for the class, and I took the class on my off time. And at the end of the class, I asked about peak flow meters. And so the following day, the young lady that taught the class emailed me, and she said, we don't have peak flow meters right now, but we could get you some. And she says, how many do you need? And I explained to her that I needed as many as she could get. She actually notified the National American Lung Association and the State of Colorado American Lung Association, and they gathered 100 peak flow meters for our clinics.
So we've dispersed them to multiple health centers. The ones that pop up in my head immediately, I know that Fountain has them, obviously Health Center at Academy has them. Within Health Center at Academy, it's already been identified as a huge benefit. Even from the clinician standpoint, it's something that they would always kind of talk to patients about in terms of patient education and how they could monitor their levels with these devices.
And I got a Teams message from one of our colleagues at one of the other sites. She says, thank you. And I said, for what? And she says, for getting the peak flow meters. I've been giving them out to patients that have COPD, to kids, and to patients that have asthma that I couldn't do that before. And with you getting the peak flow meters, I can now do that. And she says it really, in the years I've been here, it's really changed the way that things are done for our patients with asthma.
It's something we'd like to continue moving forward with as long as we can, just because it is, like I said, once we've identified that barrier for patients, it's something that we'd love to continue to push through for them.
The way that this was possible was through teamwork. When I asked my boss for help with the peak flow meters, he listened to me. And he didn't make me feel like it was something that hasn't been done, so it couldn't be done, and he gave me that hope. Everyone was on board to help me to make it possible. It was the fact that I had such great coworkers and teammates that said to me, this is possible and doable, and they wanted just as much as me to mitigate those barriers for our patients.